about the health and development of their child. So again, we say if you see a depression on that space, it's going down. It means the baby is losing a lot of fluid in its body, probably because the child has diarrhea or it's not getting enough fluid from breast milk or the other foods that the child is being given. So again, that portends danger for the child, and the child needs to go to the hospital to see a doctor. Now, the danger is not because the space is there, but the danger is because the child is losing water from his body. Then the other thing is, instead of that space going down, sometimes it becomes bulging, it becomes swollen. So again, that also is an indication that there's a problem right up here in the head of the child. So it could either mean an infection, a child who has meningitis or any other infection of the brain tissue will cause accumulation of fluid, and then that place become bulging. So again, that also is a good sign for parents to know that the child is not doing well, and take that child to a proper hospital and seek health care. It could also mean that there's a mass growing in the brain. So beyond fluid, it will also mean maybe brain tumor or anything can also cause that. Thank you.
Okay. Thank you so much, sir, for the response. Next is breast milk in the eyes as cure for jaundice. We've learned that some mothers drop breast milk in their baby's eyes as cure for jaundice. So, who wants to?
Hallelujah. It's the breast milk for the baby's eyes. Ignorance. Let me put it as ignorance, because some of us have this low mentality or low high key. We believe like the doctors are not giving the perfect treatment. Let me follow what my mom have been saying. They said the first breast milk cleans the baby's eyes, it gives the baby a sharp side, but you never knew that it's having a side effect, because that breast milk is not meant for the baby's eye for that moment. If a baby is having an eye problem, you run to the doctor knows the perfect solution. The breast milk you're giving, it may be another side effect you're giving to that baby, not a perfect cure for the baby.
Okay, so maybe I could just, in addition to what she had said, I think it's important to understand that it's the normal way that the body functions, but also for a newborn to understand that that's a very, very brand new baby. And because it's the first few days or first few weeks of life that jaundice happens, uh, basically showing that certain organs in the body of the baby that will normally take care of those processes are not well developed. If you give birth to a baby before pregnancy is term, that baby is usually called a preterm birth, right? And they tend to come with issues around immaturity. So it's important to understand how that jaundice even happens in the first place. Babies have a lot of red blood cells. Red blood cells are that component of the blood that carries oxygen around the body, provides oxygen to various parts of the body. Without oxygen, the cells in our body will naturally die off. So, because the baby has a lot of red blood cells at that point in birth, those red blood cells naturally will be broken. So when the red blood cells are broken, they release the pigment called bilirubin. Now that bilirubin, it's the pigment that gives the yellow coloration of the eye and the skin. Most times for those of us who are black in complexion, babies that are black in complexion, you don't tend to see the yellow coloration under their skin. But then you see the one in the eyes. And a lot of times, mothers, caregivers are worried that the baby has jaundice. So again, it's important to note that there is what we call the physiologic. Physiologic means normal. That's the normal function of your body. So there's a physiologic jaundice or yellowness of the eyes that happens with every newborn baby. And the reason why that is even happening, like I said, the liver is basically supposed to handle that bilirubin and clears it from the body. But because the liver is immature for the newborn, it's not able to handle the load of bilirubin that is being released from the red cells that are broken. So the natural thing is for those pigment to just accumulate under the skin and under the sclera of the eyes, the white of the eyes. But then again, as the baby grows through this, organs in the body of the baby are getting more matured, and then they're able to handle the extra loads, and then they can clear off that bilirubin, and then the yellowness disappears on its own. So most babies will have that. 70-80% of newborn babies will have jaundice. But then again, we talked about situation where the baby comes and has jaundice, but that jaundice is not the normal jaundice. So this particular one is a problematic one. Maybe because the baby has an infection or some other things like that going on in the body. So for those ones, you need to see a medical doctor to really tell. So again, it's not in the place of the parents, especially if you do not have the knowledge and the skill to distinguish between what is normal and what is not normal. I mean, to decide. So if you see jaundice in your baby and you're worried, instead of putting breast milk like it's done commonly, it's good to go see a doctor who will look at the baby and tell you that, okay, this is normal, it should go away in 2 or 3 weeks, or this is going to require treatment, basically. So again, if you understand how these things happen, which I know a lot of times, if you do not have the training, you may not really, you may be worried, right? So the safest thing to do is, if you're worried, you're not sure, is to go to the hospital and see a doctor who will give you all the assurances that what your baby is having is the normal process of growth and will overcome it over the coming days and weeks, than just sit down and assume that there is no danger in it. Again, let's avoid putting breast milk in the eyes of the baby. Just like she said, breast milk is food. Even though we said, we know that breast milk tends to contain antibodies that helps the baby to fight off infections. But putting it in the eyes of the baby will not clear the jaundice in the eyes of the baby.
Okay, breast milk as cure of otitis media. Otitis media is an ear infection of the middle ear canal. So some people drop breast milk in the ear of their babies to cure ear infection. Anyone can help attend to that?
A lot. So breast milk as cure for otitis media. We have spoken about breast milk, even though it is rich in vitamin A and especially the first milk, that the first yellowish creamy one that comes out. But again, it is not good because, number one, you can end up reinfecting the ear. Even though the breast milk is readily available and women practice it a lot, I have seen it, but it's not good. you end up reinfecting the ear, and so it's better for you to just go to the hospital for proper treatment.
Okay, so just like we've heard, breast milk.
Breast milk in ear, it causes the ear, the right hand side brain. It causes a sharp effect for the brain side. If the mothers don't know, because the ear passes message to the brain too, not only for hearing. So it causes damage. Sometimes you see the baby, they'll say, I gave birth to a baby, the brain is not normal, it's having a brain tumors or something. But you don't know that it's a part of the breast milk came to the ear that passes to the brain. So it's having a big side effect, not proper. See the doctor for that.
So just to clarify that, certain parts of the organs of the body relate closely with the brain. The ear is one of them. Some part of the upper roof of the mouth and the nose also have ways that can easily allow for infection to get to the brain. So infections there have to be treated carefully. I think that's what she was getting at here. So the middle ear cavity also connects somehow with some small openings that can lead into the brain. But it's not a common thing, okay, that you have the infection going that badly into the brain. Once you have an infection in the middle ear, the treatment for most infections is either you use antibiotics or some other things, and you don't have to apply it topically. There are instances they apply topical antibiotics, so they are made for that. But for breast milk, the main purpose of breast milk is for feeding the baby, not for curing anything. I think that's what people need to understand. So applying breast milk as cure, it's not scientific, it's not effective, it doesn't really help anything. If anything, like has been said, you can actually introduce more bacteria in the process of handling that. Not necessarily because the breast milk itself contains bacteria, but the way you handle it in order to now finally put it in somebody's ear can introduce bacteria and other things. So ideally, if your child is having earache, the best thing is to take them to see the doctor or clinician in the hospital. So we keep saying doctor, but it's a proxy. It's not necessarily that it is always a doctor. There are other people, trained community health officers, nurse, clinicians can actually provide services that would help you. So consult a medical personnel is always better than trying to do any cure on your own. Then we talked about myths generally. I want us to remember what myths mean actually, because we are assuming a lot of people understand. A myth is a false belief that is firmly held to be true, okay? Something that's not factual, but people have come to accept it as a fact, all right? So we need to understand those are the kind of things we are trying to explain here. All these things that you've heard, people believe they work, but in reality they don't. They don't. That's why we're bringing them up. Dr. Abbott talked a lot about the fontanelle. Again, we don't have a Hausa word, a vernacular word for it. Even in medical terms, that's the only name we know for it. But basically, it's somewhere, the common one that people see is on the forehead, where the bones coming from the sides, that's in the middle of the head, and then the ones from below don't kind of meet. So there seems to be a space. You feel the skin there quite okay, but then you can put your finger and the place goes deep. So people worry about that. Something is wrong, but it is normal. It will close in its own time as the baby develops. Usually 18 months or thereabout, they will just close naturally. It's a space to allow for the bone of the baby's head to grow over time. Apart from that, the brain inside also to grow and the other functions that Dr. Abbott explained. So we need to know those are normal. When a child is born newly, even the bone of the head is not really strong bone. Most of it is cartilage. It hasn't yet what we call ossify. It hasn't formed full bone yet. That's why when they fall from a height, they hit the ground. You feel that the place goes in, but then it can come out very easily again. It's like plastic in a way. So, but it's cartilage, which people call biscuit bone. So it's not fully formed. It's over time that it becomes full bone, like the one you feel that's hard, like on my head now. So it takes time for that to happen. And that space allows for natural growth of the brain and allows for the baby's bone also to form over time. So we shouldn't be taking that as abnormal. Every baby is born with that space. Otherwise, that becomes an abnormality in itself. So let's just treat that well. Thanks.
Thank you so much. Another myth is eating egg by a pregnant woman predisposes a child to stealing. It's true. These are things that people believe. A pregnant woman shouldn't eat egg because the child will steal eventually. But then, it's not true. Like we've explained, it's a myth. Things that people believe, and it doesn't happen eventually that the child steals because the mother ate egg while pregnant. In fact, the mother needs to be well nourished. So she needs a lot of proteins, carbohydrates, minerals, vitamins, all of those during pregnancies to be healthy for herself and even for the baby. Some of those nutrients are transferred to the child in utero. So it doesn't predispose to stealing in a child. I don't know, we should disabuse our minds from that. And then if you hear that from anyone, please, you can tell them it doesn't predispose to stealing.
Okay. We are still on eating egg by pregnant woman predisposes child to stealing. In fact, the child even needs these nutrients that come from the egg. I like talking about this because I'm a midwife. So you eat the egg, okay? You eat it moderately, okay? Make sure it is well cooked because raw egg can harbor bacteria which can affect you. So ensure that it's well cooked or fried and it's safe for you. It's safe for the baby too. It helps prevent neural tube defects, which can affect the development of the baby's brain while in utero. So egg is very, very good. It even helps the woman. It prepares her for labor. Okay, so because even throughout the pregnancy, as the baby is growing in her, the worn out tissues, protein, which egg is very, very rich in, helps in building up all those things. So egg is very good for a pregnant woman.
So just to expand on this, clearly, which food is forbidden during pregnancy? Now we talked about egg. People are laughing, but in your own culture, is there a food that a pregnant woman should not eat? Let's hear. Anybody? Anything. I want to hear. Sugarcane. See, why? Okay, so if you take sugarcane during labor, you will be in too much pain. All right? Any more? Mike, okay, they are sharing them. There's a mic here that can move around. Yes, I just want us to realize that it's not only about egg. There are several myths around pregnancy. I mean, I can give you one or two. She has already talked about sugar, that it will cause too much pain during labor. You want to have another reason for it? Okay, yes. Anyone else? Yeah. Yes, please.
Talk about tea.
Okay.
That if a pregnant woman is taking too much of tea, it makes the baby grow fat in her belly, and she cannot go for labor.
Aha. So labor will become difficult, eh? Because the baby is too big. So baby becomes fat. So delivering the baby becomes a problem. Okay. Yes, more?
Yes. I'm Maltina.
Yes. Maltina, you see that? Mommy, you've been starving my daughter-in-law here. You know? Anyway, don't mind.
My own,
Martina, yes?
the one I heard was the Bonvita in the tea.
Bonvita.
Yes, that's
What is
at a
special?
stage,
Yes.
as a stage, one of the trimesters that they should reduce the intake
At
so
a-
that the baby will not grow too big in the stomach and you begin to have issues with birth.
Okay.
That's what I got to know. But normal Lipton, they didn't say anything about that.
All right. So let's decide. Okay, yes, please, Enoch.
Okay.
And then Williams has his hand up too. So medical personnel is in the audience. Yes,
Okay.
go ahead. Yeah.
So, Coke.
Coke.
Yes, because of the caffeine.
Ah, big one. I am listening. Okay.
That,
What does the caffeine do to who? What?
The baby won't be able to excrete the caffeine out of the system.
Interesting. So it's the baby the caffeine goes to, not the mother. Beautiful. She eats it and the baby can't excrete it. Yes, William.
The one that I heard, that a pregnancy woman that should reduce the taking pepper. That's too much of pepper. Because if she give birth, the baby will not be
Did you
seeing
hear
well.
that? You suffered our babies eating too much pepper.
So that's the one that I heard.
She was eating raw atarugu during pregnancy, just like that. Miango pepper. She chewing it. So tell her. Anyway, I'm joking. Go ahead. Yes? Okay, so I'm asking this because different cultures have different forbidden foods. But I want you to know that truly during pregnancy, there is no forbidden food as such. All right? The normal food you eat any day, which you require to nourish you as a pregnant woman, or as a woman naturally, during pregnancy you can eat those. There's no thing like forbidden food as such. But you know, people have concerns. They have different things. The other one was about the baby becoming a thief because he's spoiled with eggs, right? After all, even children, we are told that if you give your children egg and some other nice things, they will learn to steal later because they have to maintain that habit of eating those things and they don't have money. And that's mainly because our parents used to be poor and could not afford those things. They thought of those things as delicacies. So it has no medical background. Let's be honest about it. So good nutrition during pregnancy is important. Don't worry about the weight of your baby. If you go for antenatal care, we will check and tell you, this baby is getting too big, or you are yourself growing too big during this pregnancy. Let's watch it and do things to help you reduce that so we can guide you. But normal food, eat it during pregnancy. Nothing wrong with it, okay? So these are just myths. I'll just quickly run through one or two others. Kununkanwa. We know what's Kununkanwa, right? I'm saying it in Hausa. Okay. So, you know, the way you make pap, people make the one with gero or dauro, any of those, and they make it fresh in the morning, thick kunu for the woman to drink. But the difference is this: they add potash. Or, you know, the one that's brought out in the natural one, which has a lot of potassium in it. So they add it, they call it kununkanwa. So the challenge with that is that it's been kept as very good for a woman who just delivered. So it's important they give the woman. It's part of the usual puerperal period preparation, just like they do hot bath. All of those things are supposed to be good for the woman as far as culture is concerned. But the problem is that potassium itself. Excess of the potassium can cause heart problems for the woman. And eventually she gets what we call dilated cardiomyopathy, meaning basically the heart grows enlarged and opens up wider than it should. So the muscles are no longer effective. They are flabby. They don't pump blood as they ought to. So the woman begins to cough. Blood accumulates in her lungs. They can't flow as they ought to. And she's having what we call heart failure eventually. And she could die from that if not properly taken care of. The potassium itself can actually make the heart stop beating because excess potassium can interfere with the heart beating process, which is an electrical activity. But potassium can make it slow down or stop altogether if it's excess. So there's a normal amount of potassium in the body that's required for the heart to beat, but excess of it can cause a problem. The same thing with other electrolytes that are there. But I mean, the main thing with that potash is the potassium itself that comes out there that can actually cause a problem. So we usually advise Just make normal kunu. You didn't need to add the kanwa. If you want to give them warm kunu, it's all right. It's good for their tummy. But again, tie it to other things about why must I have hot bath because I just delivered? Women here, tell us, why do they give people very hot, steaming bath, tracing everywhere? Is it punishment for you? But mommy, please give mommy Rabo the mic. I want to hear from mommy. Why do we do those things in our cultures? Any idea?
Praise the Lord.
Amen.
They will say that so that blood will not accumulate.
Accumulate where, mommy?
In the stomach, I don't know.
Okay.
And you have to drink hot water again
Uh-huh.
for almost 3 months. So
For that same reason, right?
yes,
Beautiful.
and they will boil hot water. Their hand cannot enter that hot water.
Yes.
So they will use, they will not use towel because their hand will touch it. When in the village, when I was small, I used to see it. Oh, the woman that just delivered will enter the bathroom. The elderly women will come. They will go and plug leaves,
Yes.
hot water that their hand cannot enter.
Yarrow leaves if possible. Go ahead.
They will now be carrying the water with the, you will have to sit down, open yourself.
Hey.
They will be carrying the water with the leaves and be throwing it. And you will be screaming inside the
No wonder she said punishment. Anyway, she was lucky. I spared her from that punishment.
so that the
because I was
wound,
a doctor. I
so that
stopped
the
it.
wound will heal, and then you have to drink the hot water so that blood will not accumulate.
Okay. So thanks, mommy. But here it is the issue here. The place where the baby comes from is the womb, right? The uterus. Yes, it's inside the abdominal cavity, right? But it has no link with where you drink or eat food. There's no connection at all. When you eat food, it goes through your mouth to the esophagus, to the stomach, to the small intestine, to the large intestine, and then out in the rectum to the anus, and then you have poo-poo. All right? Some of it that is water is taken out by the kidneys from the blood because it's absorbed into the blood. So his kidney now filters it out of the blood, and then it comes out as urine through the urinary tract and the bladder and eventually the urethra out here. Okay, so there is no link between where the baby comes from and the stomach where you eat food, incidentally. So when people are thinking that by drinking hot water, it will go and meet where the blood or where the baby came from, they have missed it completely. It doesn't at all. All right? There is no link. That's one. So punishment number one, they gave you hot water and it doesn't relate. Two, when they massage your body outside with hot water, do you know what they are massaging? It's just the muscles and the skin on here. And so you can be burnt. They don't reach the womb. That womb where the baby comes from, normally it's about this size when there is no baby in it. And its only opening is through the vagina. That's why the only way you can get pregnant is, again, for sperm or semen to be secreted in the vagina, and it absorbed into the inner opening of the uterus, then goes up to meet the egg that's released from the ovary that goes through the fallopian tube into the uterus. So they now meet and the baby is formed. And then the baby grows there, and in 9 months is very big. It comes out, pushes other organs within the abdominal cavity to the side, and you see it big. But the moment a woman delivers that baby, the placenta comes out, no more bleeding remains. The uterus contracts. It becomes smaller. It's not as big as when the baby was in it. But then within 6 weeks, it goes back to its original size, like the size of a fist. So it has already taken out all the blood, all the things that had to do with birth has come out with the placenta. So there is no blood in there that you are trying to now break the clot. So it doesn't even exist. So it's just, again, punishment, pressing your whole body with hot water, and you can be burnt. Nothing. Then the outside, where they pour water, like mommy said, you open yourself and they're pouring hot water. It's just the opening into the vagina, and so that's where you're really injuring the external part of the vagina we call the vulva. So you're just suffering it unnecessarily. No, you can't even get into the womb with that process. where you thought blood has accumulated. So again, very false, firm belief, right? It's a belief, but in reality, it has no fact in it. You're not doing any of the things you thought you were doing by doing those things. So again, punishment for people, unnecessary. In fact, the day my wife delivered, I gave her cold Fanta Coke to drink. Yes, my sister was raking. Her own mother was raking. I said, calm down. There's no link. You guys forget it. Hey, hot bath, I had to go and save her out of that. You don't need that. Is the water warm enough for her to be comfortable? I know she doesn't like cold water. So yes, warm water. If you can put your hand and it doesn't burn you, my wife will bath with it. If it burns you, don't try it. I will not allow. And we did that. And she was comfortable. She had her fun. Ate everything she wanted to eat. But it's there in the mentality. One mommy has told another mommy after another mommy. And truly, I have seen nurses who still do the same thing, despite all the training, medical training, because we've carried this tradition that has been passed on without facts. So it's an understanding of the human anatomy, how the body is formed, the organs, the different organs of the body, that will make people know that these things are not true. And they are really a waste of energy and effort. And in some instances, very dangerous, because you can burn somebody with that hot water. So I have seen people brought to the emergency with hot water burns because of those. And especially those women that have had episiotomy, now that cut around the birth canal to allow for the baby to come out because maybe it was too tight, and then they've been sutured. They put hot water and destroy the sutures there, and then the wound gets infected, and they get secondary bacterial infection with what we call puerperal sepsis, and it's a bigger problem. Sometimes that can lead to, let me not use too many big terms, but the blood in the veins and arteries refuse to clot. So when the woman is bleeding, she can bleed to death because of that secondary infection. And we've lost many women because of that. So practices that are abnormal, I mean, they are not actually helpful, but people are holding truly thinking they are accomplishing a lot by doing them, but they are all false. So just for clarity on that. Thanks.
Okay, in addition to that, there is no need for you to tie your tummy. Okay? There is no need to tie your tummy. That's why we encourage exclusive breastfeeding. As your baby is sucking, the body is releasing oxytocin. It's a natural hormone. So as you're breastfeeding, that oxytocin is being released and it helps contract the uterus. So that's why we encourage exclusive breastfeeding for the first 6 months. So there is no need for you to tie your tummy. It will go back to shape naturally.
Yeah. Very true. That's exactly the point.
I want to react to the breastfeeding. Once you give birth, you are doing exclusive breastfeeding. That uterus, it will go back to its normal positions. Once you are breastfeeding your baby exclusively, so the uterus will go back to its normal position. Once you are breastfeeding your baby, you'll be feeling slightly stomach pain, and blood will be coming out. So there is no need for you to do sit bed or to tidy your stomach, that the blood will be coming out. So just breastfeed your baby. And some women used to breastfeed their baby at let me say 2 minutes to 3 minutes, which is not supposed to be. You're supposed to breastfeed your baby at least 15 minutes, because the most of, let me say, 70% of the breast milk is water. If you breastfeed your baby just for 2 to 3 minutes, it's only water that the baby will take. And if you breastfeed your baby from, let me say, 15 minutes to 20 minutes, the thick breast and the nutrient, the baby will suck it. Because some babies, we will see them, they will breastfeed them. After 2 minutes, the baby will start crying. The reason is that the baby suck only water. So exclusive breastfeeding is very, very good. Thank you.
Okay, so another myth, or traditional practice rather, is traditional uvulectomy. And uvullectomy is traditionally cutting the uvula. If you notice, okay, belu belu, that's the traditional name for it. I don't know, do we know belu belu? There's something in your pharynx at the back of, yes, we call it belu belu. The medical term is uvula. So traditionally cutting the uvula is uvullectomy. So it's a very common practice, and then the people involved in doing it, you're not, their hygiene, number one, and then the instruments that they use in carrying out this practice is an instrument that they would have used on so many other people. It's not sterilized, and then their techniques too, you're not sure of the techniques. Sometimes in carrying out uvullectomy, they can cut part of the soft palate, and then the child keeps bleeding, or even an adult can bleed and then bleed to death. And then that place can get infected in some cases. It will lead to sepsis. Other times it can affect the voice box, and then they lose their voices, and some other complications that could arise from that, but it is a very common practice. So if you have someone with recurrent throat infections, what you should do is present to the hospital. Let that person be seen and assessed. It may not even be from the uvula, it could be from the tonsils. Let the person be assessed, and then interventions will be made based on the assessment of the patient. If it requires uvullectomy or tonsillectomy, it will be done in the hospital. It's a safer means. Does anyone have?
So this is actually one of the common practices up north. The Wanzamis do it for many people. Yeah. So the challenge is that somebody has recurrent sore throat. Oh, sore throat. And then the layperson, when they open the mouth, what they see is that thing hanging in the roof of the mouth. Aha! Belu belu. Shine damon. Yaga gara hade yawo. If you want to, then they now cut. And it may not be the problem. That's the actual truth. Sore throat can come from different causes. Sometimes it's just an infection. That thing is a normal structure. Some people have it longer than others, but it's a normal structure, and it's allowed. God put it there for a purpose. It may not be that useful. If it is infected, only the clinicians will know when they look at it. It's not the fact that it's just hanging there. The fact that it's maybe swollen and red and other things, then they know this is bad. But even then, they will not want to do surgery on it immediately. They will treat, let the infection go down with antibiotic, and then consider if there is a need to do a uvullectomy. But like she said, the easier part is the fact that all you need for a person who is having recurrent sore throat is to just see a doctor. Let people see things and just assume a lot, but they don't know. You have to be taught about normal human body anatomy for you to know what is abnormal when you see. So if you don't know what is normal, anything will appear abnormal to you because you are not used to seeing it. So you first have to know the normal. And the people who know the normal are your clinicians in the hospital, doctors, nurses. Those people are trained to see what is normal and distinguish between that and what is abnormal, and they will help guide you. So let's advise our neighbors as well, because this is very common practice. The issue about the instrumentation, the instruments, generally you know that they don't have ability to sterilize. If they were ever using like bleach to suck their blades in routinely, you can be sure they would kill almost any bacterium, or even some viruses could really be destroyed with the bleach. But the reality is that they don't. As they do this person, they do the next one. They clean on their hand. I've seen it even when they do shaving for people. Continuing the next person. So that really is a very simple source of infection any day, anytime. So that is something to avoid.
Are all vaginal secretions vaginal infection? A lot of patients will come to the hospital and will say they have infection. And then when you ask, how do you know you have infection? They'll say, I'm having discharge. So there's this thought that any vaginal secretion at all means that one has vaginal infection. But then, at the course of our menstrual cycle as females, at the course of one's menstrual cycle, there is this vaginal discharge, and it varies in thickness, in consistency, in color during one's menstrual cycle. So during the follicular phase of your menses, that's when the follicles in your ovaries are getting ready, getting matured for one eventually to be released during ovulation. The secretion is different during that phase. It's different during luteal phase. So when one has or notices these secretions vaginally, it doesn't mean you have vaginal infection. But then, if you notice that this secretion is unusually more than it should be, or it's foul smelling, or the color is, let's say, greenish, yellowish, or brownish, and sometimes whitish, when you notice any of those, and then associated with itching or rash, then you can present to the hospital and make complaints. But then not all vaginal secretions are infections. It's normal to keep the vaginal moist. It's not meant to be a dry place. So, but then anything you don't understand, always present to the hospital and lay a complaint. But it doesn't mean you should go to a medicine store, go get antibiotics, get antifungal drugs, creams, and a lot of things people do because they feel that they have infection and they feel that this infection has been there for a very long time, just doesn't go away. You may not have had any vaginal infection. It could just be your normal vaginal secretion. Any additions?
Okay, yes, just to add to what she had said about those secretions. So the body is designed, somehow God in his wisdom has designed the body to really take care of itself by itself. So your body adjusts as it is exposed to environmental stimulus and all those things. That was trying to mention something around homeostasis, maintaining a constant internal environment. So not to digress away from what she has said. So around vaginal discretion, so the vagina is actually supposed to be self-cleansing. So in the walls of the vagina and the cervix, that's the womb, the opening to the womb, there are glands that secretes those things, that the secretions we have, and they are normal, like she said. Most times the normal secretions are colorless. At times they might turn white, and that's okay. And it's not the same quantity for every woman. Some women will have little discharge on a daily basis. Others will have much. But like she also had said, during the monthly cycle, the consistency, the thickness, the quantity tends to change. And that's okay. That's okay, right? So it's basically supposed to clean itself by itself. The same thing with the ear. A lot of times we put a lot of things into our ears. A lot of time we put a lot of things there. But the ear is actually supposed to clean itself by itself. That secretion, that sebum that comes out, it's basically the process of the ear cleaning itself and all those things. So the danger of putting things in places that will naturally clean themselves by themselves is that we introduce infective organisms into those places and they cause diseases for us in the process. So again, we need to be careful. So again, like I had mentioned, for the ear, sometimes the secretion can become thick and blocks the air canal, the external air canal. So in such instances, you also can seek help to ensure that it's removed safely, because the danger is if you have very thick secretion, in trying to force it out, you're going to push it inside, and it will give you temporary deafness. You're not going to hear through that ear because you've already blocked that opening. So again, it's good to know what is normal and what is abnormal. For the vaginal secretion, she talks about changes in color, and those colors are the things you see, but then accompanied with the other signs and symptoms that she talked about: redness, itching, hot flushes, and all of those things. So those are signs that infection is actually happening around there. So again, just to add to the other things we have discussed around traditional practices for a woman who has given birth or who is about giving birth. Dr. Jerry talked about that kununkanwa and the wankanjegu. One other practice that it's common, especially in the north, I don't know if people are familiar with gishiri cord. Gishiri cord. Traditional episiotomy. Yeah. So usually it's done for a woman who is having her first baby, usually a small girl which not really matured enough to have babies. So common practice in the north. So is that gishiri, wankanjego, kununkanwa. So that's the tripod. So what they do is, the young girl is unable to deliver by herself. She had labored and labored, but because the passage is not ready for the baby to pass, they think the place is too small for the passage of the baby. They bring maybe a traditional bed attendant. Sometimes even the barbers he talked about, the local barbers come with their local knives, and then they cut the walls of the vagina, or sometimes even the wall of the cervix, the mouth of the womb. So the whole idea is those cord is going to expand the passage so that the baby will come out. So those practices makes the woman bleed. And we talked about bleeding as a cause of maternal death yesterday. So in the process of trying to intervene, you cause bleeding for the woman. She bleeds out, and maybe bleed to death if no proper intervention happens. But the other danger that could also happen, it's the risks of infection, given the sepsis Dr. Jerry has described, and a lot of things follows after that. So again, as we interact with people within our communities, in our villages, let's try and enlighten them around some of these practices. They're cultural practices, but they do not have any benefits. But rather, they tend to increase the danger for the woman and the baby that she's carrying. So again, the other myth that we have on our list is sometimes babies are born, both boys and girls, with enlarged breast. Has anyone seen that? At birth, the breast of the baby is enlarged, both for male babies and female babies. And mommy want to say something? Yeah, please give her the phone, the mic.
I saw it when I was small. And the elderly women that are coaching the mothers, they will say it's, whether it's infection, I don't know. They may be trying to press out something. They even try to, they say it will bring out milk. I don't know.
Again, thank you so much, ma'am. I'm happy that our mother is the one mentioning that. I was going to mention that. So people see that and they get worried. So one thing we need to remember is that when the baby is inside the womb, it's directly under the influence of everything that is going on within the woman, the mother. In pregnancy, there are changes in hormone levels. right? The changes in there are hormonal changes, and that's why you see after pregnancy, the body of the woman changes. Some of them will add weight, and a lot of things happen to them. And most of these changes are because of the increase in hormones in the body of the woman. So these hormones tend also to affect the baby. Estrogens are the hormones that helps with breast development. At puberty, the level of hormone in the girl child, estrogen in the girl child increases, and it gives the breast enlargement. During pregnancy, the same thing. The level of estrogen is increased. And these babies in the womb are affected by this estrogen, so they have this breast enlargement. It's a normal thing. If you allow that baby, after 2-3 weeks, the breast goes down. So what mommy said, most times, traditionally, are the things that it's done. This is not normal, let's press and bring out. And again, the other thing I might want to say is, if you even pressed, breast milk is going to come out. And they're all normal, perfect. It's not anything to be worried about. So let's discourage such practice within the communities that we live, places we have contact with women who have had deliveries and they're worried about these things. The danger of the pressing is that, so beyond pressing, sometimes they even do scarification. They put blades or knives to cut and all of those things. So again, that also increases the risk for that child developing infection, mastitis, becomes swollen, becomes painful, maybe even discharge poison, depending on the severity of the infection. So those enlargements are okay. But if you're worried, like I would always say, trust your instinct. If you're a parent and you're worried about those things, trust your instinct. Go to the hospital, you get proper explanation or proper management for those conditions if it happens to be something abnormal. But no matter how big the enlargement is, for some babies it's small, some babies, in fact there was one I saw, the breasts were like, and it's a newborn baby, they're already big. But those things are actually normal, so not anything to be worried about.
Aside even breast enlargement, for females, they could menstruate. You notice in the diaper, is a newborn, in the diaper, there's usually blood stain. So again, it's just maternal hormones in circulation of the child. It will all wear out with time. So it's nothing to get worried about. But again, anything you don't understand, instead of giving herbal medications or seeking traditional interventions, always present to the hospital. Okay, so another practice is, okay, a question.
All right. My own is not a question. I want to add something about this vaginal discharge. As you said earlier, it's not all the vaginal discharge that is infection. You get? So what I want to add is that, you see, we are not saying that there is not vaginal infection, but due to traditional belief, you see somebody that has been having frequently urination. They will just say, somebody will just sit down and say, she's having infection. He's having infection. You see, when you have kidney failure, it can cause that. You won't go for tests, you won't go and see your doctor, but you start taking some herbal medicine for infection, which maybe your problem, you are having kidney failure. And another one that I want to add is that some people, you see that they are having, their eyes are yellow. That's yellowing. You see, if you are having hepatitis B and it has reached the stage that can cause problem in your liver, sometimes it can give you sign like that. you'll be having yellowing eyes. You cannot go for tests, doctors to check. But some people, they normally say that if you're having infection, it can cause that. But the only thing that I'm trying to enlighten us is that once you have some experience like that or some sign and symptom, it's good for you to go and see your doctor. It's good for you to go and visit lab. I think that will help you. And this vaginal secretion. Secondly, what I want to add, some people, abortion. Some ladies, they have frequently abortion. You understand? And it will take some distraction inside your organs. So it can cause so many issues in your body system. And when that body is trying to accumulate, adjust, there are some signs that you'll be seeing, which you don't know, you cause it by yourself, but you begin to take some medicine. And this Aboki medicine, herbal medicine for infection, they normally advertise. You are just passing. They are advertising about an infection medicine, and this infection is very rampant. Some people, once you just feel some sign, you just, okay, I'm having an infection, without seeing your doctor, without visiting any lab. So I would like to advise all these Aboki medicine, sometimes, this herbal medicine, you don't even know the source. You take it and you continue causing a lot of problem in your health. Thank you.
Praise the Lord. Even for some pregnant women, for discharge is normal. It's normal, it's not an issue. So for some pregnant women, they take it like a shock or a scared, but it's normal for the baby too. It's normal for the pregnant woman. Thank you. And for the ear again, you see, let me use this theory. In those days, you see, even now it's common, like this foul feather. Most of us enjoy using that one to clean our ear. You say, somebody will say, I'm carrying away that. I prefer that one more. It's having another side effect. It's not good. Whether you're having a problem, you go to the doctor.
Yeah, so just maybe there are lots of things we can talk about, but we'll stop here with just one more that we'll look at. Have you been in those days when your parents would tell you, don't play in the rain, you are going to catch pneumonia? Okay, good. So that's a very good one. Does the rain cause pneumonia? Cold causes pneumonia. Please, if you believe cold causes pneumonia, raise your hand. One person only at the back. Even you that said yes, you didn't raise your hand. Yes, sorry. You also, I were too. The senior I were too won't agree with you, so you better learn. Anyway, cold causes cold. Let me leave it that way. But cold doesn't cause pneumonia. Pneumonia is an infection of the lungs. You know where the lungs are? Anybody? Where are the lungs located in the human body? All right. On the inside of the chest cavity, right? These chest walls that we have that you touch the ribs. On the inside is where the lungs are. So, but when you have cold, where do you feel it more? When you are exposed to cold, where do you have more problem in your body? Any of you? Sorry? The nose, the throat. So by the time you begin to have challenges with breathing in your lungs itself and having chest pain, that is probably the time that you'll be thinking of pneumonia. So the common thing is that because of the exposure to the cold, there are viruses there that actually thrive well during cold. In your normal airway, from the nose to the upper roof of the mouth and even the throat. They are comfortable there. They don't do you any problem. But when you get into the cold, they multiply rapidly and cause problem for you. And that's when you begin to have those catarrh-like thing. And actually, that's the commoner thing with cold. When it stays too long without treatment, there may be a possibility of secondary bacterial infection, which can now get to the lungs. But you see, it's not the cold that caused the pneumonia, if it ever happens, right? So many people who have cold and never progress to pneumonia. I'm one of those. In a year, I can have the cold like almost every month, but I will never have pneumonia in my entire life. I've never had, actually, my entire life. But many people think pneumonia is a common illness and is associated with cold. No. The pneumonia usually is a bacterial infection of the lungs, sometimes viral infection of the lungs. But usually for that, you don't need any antibiotic. It usually can, go on its own. Most viral infections actually go without any problem. So by the time you really have pneumonia, a doctor would have had to diagnose. It will show on chest x-ray. It will really show on your severe chest pain. Just breathing deep in like this, you will scream for pain because your chest cavity and the covering of the lung itself will be painful. So pneumonia is not as common as we think. Please, let's just let people know. Exposure to cold can cause you upper respiratory infection in terms of with viruses that you can have, like what we call the common cold or catarrh. That is what we know very rapidly, okay? But for it to progress to pneumonia, you need another level of exposure to like bacterial infection, which is mostly the common one that causes the pneumonia. So please, cold doesn't cause pneumonia. Yes, exposure to cold may not be good for you, but it's not what causes pneumonia, all right? It causes catarrh, a bit of sore throat, and that may be it. And that you can actually treat with just painkillers, good rest, some hot pepper soup, regular, you'll be fine. And you'll be fine, yeah. So you don't really need to go and start asking for antibiotic. A diagnosis of pneumonia can only be made in the hospital by your doctor. So if you feel like you're worried about getting pneumonia, go to the hospital, let them decide. But don't think just that you caught cold or you have common cold or catarrh, that means you have pneumonia, okay? That should do it, right? Thanks. So, questions? Oh, okay, because the time is up. But we're supposed to stop at 7.
Okay, just before we take our questions, sometimes people think that pneumonia is a lifelong disease. Like, I have pneumonia. That's my sickness. That's what people say. I have pneumonia. So it's not a lifelong thing. Once you've had pneumonia and you're treated with appropriate medication, it goes. It's not a lifelong thing. And then usually there will be cough, difficulty breathing, there will be chest pain associated with the symptoms, yes, fever too. So it's not just the chest pain, or I don't even know the symptoms that they tag pneumonia. Yes, so it's not a lifelong thing. So we'll take our questions now.
So just a quick one. Like Dr. Jerry has said, most of the things that cause the cold are viruses. And I know a lot of people are in the practices. I have cold and catarrh, Ampiclox. Yeah, and that's an antibiotic. And he has said viruses are the things that cause those cold, those cough and catarrh. And they most times don't need any treatment. They will go on their own. So those use of, and then the sad thing is that when you go buy those Ampiclox, you buy one card. And one card, if you're taking, maybe you take for 3 days, 2 days or 3 days. The problem is if you have using antibiotics indiscriminately, what we are generally creating is antimicrobial resistance. The bacteria that these antibiotics are supposed to kill will also develop ways to become resistant to these antibiotics because the dosage you've taken, it's not enough to knock them out completely. So that the next time you use the same antibiotic when you need it, it's not going to work for you. So not just Ampiclox, but all antibiotics. Let us not use drugs indiscriminately. There are drugs that you can go and buy over the counter. I don't have a problem if you go buy vitamin C to take or buy paracetamol. to take because you have mild headache or body pains. But using those antibiotics indiscriminately, it's causing a lot of problems globally. In fact, it's one of the major, yes. So only please on prescription, go to a healthcare provider who will assess your need for antibiotics, and then he prescribe the right doses and the right duration that you should take those antibiotics.
Okay, so our questions.
Praise the Lord. I learned that when a nursing mother, when you are breastfeeding your newly born baby and you lie down while breastfeeding, that the breast milk can go to the ear and cause pains and pus in the ear. Don't know how far that one is.
Mine is about newborn babies. I remember when I had my own babies, nobody pressed my baby's head with hot water. And I keep hearing, oh, you need to press the baby's head. You know, that's what I hear these days. So I don't know if they still do it. What's the effect on the baby? And apart from the head, other things they do on the baby's body. They will press the head, they will turn the baby's hand, do that one. They will hold the baby's legs, turn the head upside down, do this. How will that help?
Praise God. Okay, my question is, when my sister gave birth to her second baby, I think for 2 days after, she noticed something was coming out of her. It was very heavy, like it was from her vagina. It was very heavy, like it was blood, but it wasn't blood. When it dropped, it was pad that was put inside of her. But it wasn't done when she gave birth to the first child. So I want to ask, how safe is that? Because I've had someone said they do it. When you give birth, they put pad there to help you absorb the blood.
Praise the Lord. Okay, when I was coming in, maybe I came late, the first speaker, she was saying something about egg, and I keep hearing her saying very important, very important. So that very important dragged my attention there. We have two types of eggs, so I don't know which one she was classified into very important, very important. The natural one, which produced by maybe through intercourse, and the chemical one, which they produce called agric. So I believe it's two different types entirely.
Okay, mommy, when you said that the baby can get infection, is it that the breast milk will go in directly into the ear from what? Okay. It will go like, okay, it's not the breast itself that will shift to the ear and then it will go there. It's not possible.
I think what they are trying to discourage is feeding the child while the child is lying down,
yeah, it's
so
by
that it
choke.
doesn't choke
Yes.
or aspirate.
Yes.
Maybe that's what they are trying to avoid, not that it will go to the ear.
All right. So let me try and clarify. So mom has a point, right? There's a connection between the ear and the oral cavity. And for babies, usually for us adults, that linkage is slanty because we have grown. But for babies, it's more or less like horizontal. So if you feed your baby while the baby is lying down, there's a chance that breast milk can naturally drip down into the ear and all of those things. But again, there is that connection between the inner ear and the oral cavity. So yeah, so that could happen for a newborn, and that's why it's usually discouraged. Don't breastfeed your baby while lying down. But again, we also talked about the advantage of doing the proper thing. The baby loses body heat easily. When you breastfeed and you hold your baby very well, there's exchange of heat between mother and baby, and that keeps the baby warm, prevents hypothermia and all those things. So again, that idea could happen. But like they had also mentioned, it's also going to prevent the baby from choking. So instead of the milk going through the esophagus, it goes through the windpipe and goes maybe into the lungs if care is not taken, and that baby could choke from that. So I think let's basically discourage mothers from lying down to breastfeed. Yes.
I've seen where some babies have pus in the ear, and the explanation to it is that
breast milk.
You must have fed this child while lying down.
Okay.
So, mommy, I think I have to come in here. Really, what Dr. Abbott described is a very rare thing. It's not the common thing. So if I see a child with pus coming out of the ear, I will not think about breast milk as the first cause. There are several causes of middle ear infection. And for it to even be bringing out pus, by then the eardrum has ruptured. That's why you can see pus coming out. And it may not even have to do with breastfeeding at all. So people should not rush to conclusions. It's wrong. Now, 1,001 women have fed their babies lying down, as long as they don't choke them with the breast, like you sleep off and your breast falls into their face and they can't breathe because the breast is big enough and covers the baby's nose and mouth at the same time, so they can't breathe. And that's the major danger with breastfeeding while lying down. But in terms of that thing happening, it's a very narrow opening. It's very, very minuscule. And if the baby is just sucking and swallowing at that time, it will not go there. But sometimes the baby may cry, and in the process, the milk is not being swallowed down the esophagus, and it can spill into that space a little. But that's a very rare thing. It's not the common thing. So let's not associate ear infection with the fact, oh, a mother was lying down, and that is why, while breastfeeding, and that's why the baby has middle ear infection. No, it shouldn't be at all. The discouragement about breastfeeding while lying down, I think they've stated it. The issue is that fear that the breast of the mother can actually, she may fall asleep and then the breast covers the baby's nostrils and the baby can asphyxiate. In other words, may not be able to breathe anymore because the source of air has been cut off by that breast and the baby can die off. Remember the story in the Bible of the two women who had babies. One was lying down carelessly and the baby died, and the next morning she had already moved it to the other woman and picked the other one, and King Solomon had to separate who owned the baby. So it's a similar thing that might have happened to that woman. She had slept off and let her breast close the nostrils of the baby, and the baby died overnight. So one has to be careful. That's just the danger, the biggest danger with breastfeeding while lying down. Okay? Not about otitis media. Those are, the likelihood of it is much smaller than any of those other causes of infection of the middle ear. And then this baby bracing of head, and none of those things is needed. Or the body, all the massage, the extra, even the crazy hot bath that they also do, just like you did for the mother. What are they pressing in the baby to bring out what? Once a baby is born after 9 months, the baby is normal. The baby doesn't need anybody doing anything again. No matter how you try to mold and shape the head, it will be the shape God has decided it will be for that baby. So stop trying to say, I want to make the head to be like this. Why don't you try to give them Oyibo nose as well? It doesn't work. Those things are just a waste of our time, and they can be dangerous. They are not good for those children. So the baby is normal. They don't need all of those. Let's treat them carefully, that they are comfortable. In the process of trying to massage their body with all kinds of things, you can break the bones of the. Remember, those bones are fragile. They are not fully born yet. It takes time for all those bones with the cartilage there to fully become bones. And in all those processes, you can even press so much that you damage an organ under. All right? So people should not do all of those massages and compressing and all of the wahala. There is no need for all of those. Feed the baby, birth the baby, keep the baby clean and dress, In fact, the other thing we say about dressing babies, the one that's so annoying is you're feeling hot, but you put 3 layers of clothes for the baby, then you add sweater, then you bring that shawl on top and add again. And then you've closed all the windows. Then you are now putting, meanwhile you are sleeping in your pants. You are just comfortable. And the baby is in that hot oven. Then later the baby is crying. You are wondering, where is this baby crying? They won't allow me sleep. It's not comfortable. So the sign for us, usually we say, if you as a mother, you are feeling cold, your baby will feel cold. If you as a mother in that environment, you are feeling hot, your baby will feel hot. We agree the baby is not like an adult fully, but the skin is actually, if it is a term baby, born after 9 months, the baby's skin feels what you feel. You don't need to do too much extra for the baby. Okay? So sometimes in trying to just protect them from cold, we actually kill them with heat, which is not necessary. Let's just do average. Moderation in everything is important.
Okay, so the other things you talked about,
Yeah, okay.
the pad.
Oh, yes.
That's a mistake. That's a mistake on the part of the caregiver. So they forgot the pad there. So usually when a woman delivers, trying to clean up after delivery of the placenta, they tend to use pad to clean up bloods and cloth. And so sometimes some midwives or the person taking the delivery will keep the pad there so that it can suck up blood and all those things. But the ideal thing is to take it out before she leaves the labor room. But once it's forgotten and the woman does not remember to take it out herself, it stays there. The danger again is that it can cause infection for the woman. So I think that was an error in the part of the person who provided care.
So let me call it what it is. It's negligence of duty. So it's actually bad practice that you put something in someone and forget it there, which is not supposed to be there. It's a temporary measure to stop bleeding. You take it out before you let the person go. And it shouldn't be there more than a day. Usually you take it out within that same day if they're in the hospital. Otherwise, that infection, and actually for me, the infection of the womb is the most scary one because it can spread quickly. The womb or uterus is one of the most highly vascularized organs of the body. Vascularized meaning it has a lot of blood vessels supplying blood to it. So again, the same time it will have a lot of veins taking blood from it. So if an infection enters there, it can easily enter the blood and become an infection everywhere in the blood system. That's what we call septicemia. So it's a sepsis. And that is why it can now cause the blood not to clot and they can bleed to death. Or the secondary infection itself can kill them. It can be very bad and difficult to treat with bacteria, with antibacterial. So it's very scary that somebody does that. So if you are, or you or your sibling is in the hospital having a delivery and those things, please, before they go, ask that they should check if anything is there, they should take it out before she leaves. It's important. So that was a bad oversight.
Let me talk about the egg. Sir, please, the egg we are talking about is for the protein, it's for the fowl. Kaza. That is the egg we are talking about, not the other egg. Thank you.
So I think you need to get it really, whether it's a poultry raised chicken or the normal free range chicken from the village, the egg is fine. Please calm down. We are not worried about anything. It's all protein. The chicken in the poultry that they raise with agric feedings and all the whatever mixed feeding that they've made to make it grow fast, right? is still protein. The chances that we worry about is that when it is not organically raised, there is a chance that those same chemicals they use in the feeds can harm your body. But that is common to everybody, not only pregnant women. All right? And it's not about just the egg. It's what will happen to the chicken itself. It's not the egg. All right? Because that's where the chemicals settle. They settle in the chicken, not in the egg. All right? So any egg at all is good for them in terms of whether it's poultry raised in the house or is the one that, the agri poultry or the one that's free range, our village one.
As long as it is well cooked or fried, it's safe for you.
So, okay, so with this, we have come to the end of our discussion this evening. If you still have questions, you can ask any of us outside, yes, after now. So we'll invite the pastor for announcements and closing.